Ruth, sometimes this schema is really involved in self-harm behaviour that feels really rigid and difficult to shift when the patient kind of feels like punishing themselves is really justified and the way to actually make a wrong right. So we're talking about the punitiveness schema and the effects of that on our clients. I'm Rita Union, clinical psychologist, advanced schema therapist, supervisor trainer.
And I'm Ruth Holt. We're working our way through all 18 schemas from schema therapy, and particularly this schema is one that is often held in the critic mode, the punitive critic mode, because it's a belief that people should be harshly punished for making mistakes. It really involves a lot of anger, punitiveness, intolerance of any ordinary human qualities, and really has a lot of difficulty with the idea that there can be extenuating circumstances or just being a human. You know, those are considered not good enough, that in fact what needs to happen is people need to be punished when they fail to meet expectations. So it can present, you know, often with two other schemas, particularly unrelenting standard schema and also defectiveness schema. But it really is, I guess, in a way, kind of playing out the trauma that often clients have had, where they themselves have been punished severely by their parents growing up.
And I think it's a difficult distinction between the unrelenting standards hypercritical schema and punishment, because I guess one schema is kind of more about that criticism, you know, you're not going to do it well, you don't do it well, etc., etc. But the follow through from that is you are punished for not doing it well, just the action associated with the thing that they didn't do well. So that's kind of a bit of an important distinction, I think.
And I think, you know, there certainly are some cognitive interventions you can use, educating clients around the lack of usefulness. You know, if you really want to help someone get better, punishing them actually isn't that effective. There's a lot of research that says that's not the case. Even just in our own experience, you know, if we were learning a new skill and someone was hovering over us saying, well, you know, you can't do this and I'm going to hit you until you get it right. I'm not sure how much time you'd give to learning under that regime.
Yeah, and that reminds me of a group exercise where we try and emphasize that point, the idea that punishment doesn't actually help us learn or thrive, where we, usually a therapist, we send out of the room, and as a group we select an object that we're going to use for the exercise, and we ask the therapist to come back in, and the therapist is asked to identify which object we've selected. And as the therapist is looking for, you know, is it a mirror or is it a chair or whatever it is, you know, the group are encouraged to go, you're stupid, you don't know what you're doing, you know, you deserve to be punished for that, etc., 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 and just kind of noticing what that feels like, and then asking them to step out, come back in again, but actually cheerleading them. And realizing that the cheerleading approach actually gets them to thrive and find the object. And that opens up a discussion about this idea of, does punishment really help us perform better?
And I think certainly the neuroscience would be helpful too in terms of, you know, whether we're eliciting shame or whether we're kind of allowing that access to the frontal cortex. You know, if we're in a position of being supported and safe, we've got more capacity to think laterally, to problem solve, even to hear better, you know, is actually encouraged when we're feeling safe. Whereas if we're feeling threatened or shamed, all those things start to shut down, which makes it really hard. Another intervention that Joan Farrell and Ida Shaw talk about, I think can be useful with this schema, where you maybe get your client to write out all those punishing statements that their critic says to them. So, and, you know, put one on a post-it note, next one on a post-it note, you know, maybe 10 on a post-it note, and get them to elicit all of those punishing statements. And then what you do as a therapist is you put your arm out and you say to your client, okay, so now I'd like you to get that statement, put it on my arm and say it to me. So get them to say, you deserve punishment. You will never learn, whatever those phrases are. And that is confronting, absolutely, for clients, but it also helps them to have that moment where what they say to themselves, they would never say to someone else, and starting to develop that self-compassion.
Yeah, and the discomfort associated with that. You know, I mean, there's always the yes, but yeah, but you know, you don't deserve those things, I do. So you kind of need to try and manage that resistance as well. But I think that's part of the work initially. You know, we talk about this idea of self-compassion and developing the good parent part of the patient. And before we get to that step, we kind of need to model that for them, that they start to have a little bit of, you know, awareness or the room for this, or doubt that, okay, so maybe I don't deserve punishment, you know, and then they can start to perhaps be a bit more compassionate and kind and allow themselves to make a mistake, and that I don't have to be punished for that.
Yeah, and that's where, you know, the childhood origins are vital when you're working with this schema, because so much of the punitiveness schema has been learnt at a very young age in very powerless circumstances. So you really need to do the imagery rescripting work about going back, preventing the punishment, challenging that way of talking and behaving with their child. And so they have an experience of protection, and also, you know, a way of helping them know that all children make mistakes. In fact, that's how you learn, is making mistakes. So we do need to provide a lot of corrective emotional experiences in helping clients feel safer and more compassionate.
Yeah, and one of the other things that just occurred to me as we're talking about this, Ruth, I had a client who, you know, there was quite an obsessive compulsive nature to the punishment. You know, like if there was a mistake and there was discomfort in the body, the actual punitive act would make it feel better, a bit like somebody with an obsessive compulsion, you know, kind of needing to wash their hands and then it felt right. So there's different ways in which the punishment can manifest itself and how you work with that to try and shift it. Again, I kind of go back to self-harm because I think it's, for me, I've really kind of seen the severity or the force of that schema with that presentation.
Mm. Yeah, well, that's our 7 minutes up, Rita. And we encourage people to have a think about maybe looking further into this. We talk about this in the workshops that we're running that are listed at the end of this slide.